Hey friends, Olivia from Ollie. Between new routines and the ultimate group project known as parenting, you need science-backed solutions that work with your life. That's where Ollie comes in. Start your mornings off right with multis made to support nutrition and immune health. Choose from our lineup of gut-supporting probiotics, and we've got occasional sleep support to help the whole fam chase their big dreams. Head back to class with the #1 gummy supplement brand. Stock up on ollie.com today. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
This episode is brought to you by Welch's Fruit Snacks. Back to school season can be tough on parents, but choosing a snack you and your kids can both get behind doesn't have to be. Stock up on Welch's Fruit Snacks, made with whole fruit and now made with no artificial dyes. It's a snack kids already love and one you can feel good about giving them. Go back to school with Welch's Fruit Snacks, now made with no artificial dyes.
Hey everyone, Chris here from Red Prep to Go, and welcome to another episode of our USMLE Step 2 Questions podcast. In this episode, I'll be reading 3 more orthopedics questions from our online Qbank, and of course, you can read these questions and more at medprep2go.com. And so, let's get started with question 1, Orthopedics 7. A 19-year-old man is admitted to the hospital for surgical management of a closed comminuted femoral fracture sustained in a motor vehicle accident 24 hours ago. While awaiting surgery, the patient suddenly develops acute shortness of breath and confusion. On physical examination, his temperature is 37 degrees Celsius, or 98.6 degrees Fahrenheit, pulse is 115 beats per minute, and blood pressure is 110/70. Pulse oximetry shows an oxygen saturation of 88% on room air. Neurological exam reveals disorientation to time and place, but otherwise no focal deficits. Examination of the skin reveals several non-blanching reddish-brown macules over the base of the neck and bilateral axillae. Which of the following is the most likely finding on fundoscopic examination? Is it A, cherry red spot at the macula, B, diffuse retinal whitening and edema, C, intraretinal hemorrhages and intravascular fat globules, D, optic disc edema with blurred margins, or E, pale opaque retina with a box-coloring appearance of the vessels? And the correct answer is C, intraretinal hemorrhages and intravascular fat globules. This patient presents with the classic triad of fat embolism syndrome, FES, which is hypoxia, neurologic abnormalities, and petechial rash. FES most commonly occurs 12 to 72 hours following the fracture of a long bone, such as the femur. While the diagnosis is primarily clinical, ocular findings, including puncture-like retinopathy, can occur when fat emboli enter the microvasculature of the eye. This manifests as cotton wool spots, intraretinal hemorrhages, and occasionally the visualization of fat globules within the retinal arterioles. Answer choice A, cherry red spot at the macula, is incorrect. This is the classic finding of a central retinal artery occlusion, CRAO, or certain lysosomal storage diseases such as Tay-Sachs. While fat emboli can cause ischemia, the diffuse puncture-like pattern is more characteristic than an isolated cherry red spot. Answer choice B, diffuse retinal whitening and edema, is incorrect. While localized whitening occurs, diffuse whitening of the entire retina is more typical of a CRAO rather than the embolic shower seen in FES. Answer choice D, optic disc edema with blurred margins, is incorrect. This describes papilledema, which is caused by increased intracranial pressure. While FES causes neurologic symptoms due to cerebral microemboli, it does not typically present with the generalized increased ICP required to cause papilledema unless there is a massive stroke or cerebral edema. Answer choice E, pale opaque retina with a box-coloring appearance of the vessels, is incorrect. This describes the late stages of a central retinal artery occlusion where blood flow has slowed significantly. Key learning point. Fat embolism syndrome is a clinical diagnosis following long bone or pelvic fractures characterized by the triad of respiratory insufficiency, neurologic impairment, and a petechial rash. Ocular manifestations, though not part of the primary triad, include intraretinal hemorrhages and cotton wool spots caused by microvascular fat emboli. Treatment is primarily supportive, including high-flow oxygen and, in severe cases, mechanical ventilation. Question 2, Orthopedics 8. A 16-year-old gymnast presents to the emergency department after sustaining a right knee injury during a floor routine. She states that she landed awkwardly with her foot planted, her knee slightly flexed, and her torso rotating internally. She felt a popping sensation followed by immediate severe pain and a sensation that her kneecap moved out of place. On physical examination, the right knee is held in slight flexion. There is a prominent deformity noted over the lateral aspect of the knee joint. There is a significant tenderness along the medial border of the patella and a moderate joint effusion. Which of the following is the most appropriate next step in the management of this patient? Is it A, application of a knee immobilizer and referral to outpatient orthopedics? B, closed reduction via medial pressure on the patella with knee extension? C, emergent magnetic resonance imaging of the knee? D, immediate open surgical stabilization? Or E, weight bearing as tolerated with a hinged knee brace? And the correct answer is B, closed reduction via medial pressure on the patella with knee extension. This patient has a classic presentation of an acute patellar dislocation. This injury typically occurs in young athletes due to a non-contact twisting motion, such as internal rotation of the femur on a fixed foot or flexed tibia, or direct trauma. The patella almost always dislocates laterally due to the natural lateral pull of the quadriceps muscle. The first step in management of an acute dislocation is closed reduction. This is performed by applying gentle, medially directed pressure on the lateral aspect of the patella while simultaneously and slowly extending the knee. This maneuver often results in an immediate reduction and significant relief of pain. Answer choice A, application of a knee immobilizer and referral to outpatient orthopedics, is incorrect. While immobilization and follow-up are part of the post-reduction care, the dislocation must be reduced acutely to prevent further chondral damage and alleviate pain. Answer choice C, emergent MRI of the knee, is incorrect. While MRI is often performed eventually to assess for associated injuries like medial patellofemoral ligament tears or osteochondral fractures, it is not the immediate next step. Reduction should precede advanced imaging. Answer choice D, immediate open surgical stabilization, is incorrect. The majority of first-time uncomplicated patellar dislocations are managed non-operatively with reduction and physical therapy. Surgery is generally reserved for patients with recurrent dislocations or significant associated intra-articular fractures. Answer choice E, weight bearing as tolerated with a hinged knee brace, is incorrect. This is part of the rehabilitation process after the patella has been successfully reduced and the initial period of acute inflammation has subsided. Key learning point. Patellar dislocation most commonly occurs laterally in young, active individuals. The diagnosis is clinical, often characterized by a lateral deformity and tenderness over the medial patellofemoral ligament. The most appropriate initial management is closed reduction using medial patellar pressure while extending the leg, followed by immobilization and physical therapy.
Hey friends, Olivia from Ollie. Between new routines and the ultimate group project known as parenting, you need science-backed solutions that work with your life. That's where Ollie comes in. Start your mornings off right with multis made to support nutrition and immune health. Choose from our lineup of gut-supporting probiotics, and we've got occasional sleep support to help the whole fam chase their big dreams. Head back to class with the #1 gummy supplement brand. Stock up on ollie.com today. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
This episode is brought to you by Welch's Fruit Snacks. Back to school season can be tough on parents, but choosing a snack you and your kids can both get behind doesn't have to be. Stock up on Welch's Fruit Snacks, made with whole fruit, and now made with no artificial dyes. It's a snack kids already love, and one you can feel good about giving them. Go back to school with Welch's Fruit Snacks, now made with no artificial dyes.
Question 3, Orthopedics 9. A 24-year-old man is brought to the emergency department after following directly onto his outstretched arm while snowboarding. He reports intense pain and an inability to move his right shoulder. In physical examination, the right arm is held in slight abduction and external rotation. The normal rounded contour of the deltoid is lost, appearing squared off, and there is a palpable fullness inferior to the coracoid process. The patient is unable to touch his left shoulder with his right hand. Neurovascular examination reveals decreased sensation over the lateral aspect of the right shoulder, but distal pulses are intact. Which of the following is the most likely complication associated with the injury in this patient? Is it A, axillary nerve injury, B, brachial artery rupture, C, Hill-Sachs lesion, D, long thoracic nerve palsy, or E, rotator cuff tear? And the correct answer is A, axillary nerve damage. The patient presents with a classic anterior shoulder dislocation, which accounts for over 95% of all shoulder dislocations. The clinical findings of an abducted, externally rotated arm and squared off appearance of the shoulder due to the humeral head no longer being in the glenoid fossa are diagnostic. The axillary nerve is the most commonly injured nerve in anterior dislocations because it winds closely around the surgical neck of the humerus. Injury to this nerve results in weakened shoulder abduction of the deltoid and decreased sensation over the lateral deltoid. Answer choice B, brachial artery rupture, is incorrect. While vascular injuries can occur with shoulder trauma, they are much more commonly associated with displaced supracondylar humerus fractures or high-energy axillary trauma rather than standard anterior dislocations. Answer choice C, Hill-Sachs lesion, is incorrect. Although a Hill-Sachs lesion, which is a compression fracture of the posterolateral humeral head, is a common consequence of an anterior dislocation, the decreased sensation over the lateral shoulder suggests an axillary nerve injury. Answer choice D, long thoracic nerve palsy, is incorrect. Injury to the long thoracic nerve causes winging of the scapula and is typically caused by repetitive trauma or surgery in the axillary region, not by a glenohumeral dislocation. And answer choice E, rotator cuff tear, is incorrect. While rotator cuff tears are frequent complications of shoulder dislocations in elderly patients, the decreased sensation in the lateral shoulder in the age of this patient are more consistent with an axillary nerve injury. Key learning point: anterior shoulder dislocation typically presents with the arm in an abduction and external rotation with a loss of the normal deltoid contour. The most common nerve injury associated with this displacement is the axillary nerve, which should be assessed by testing sensation over the lateral shoulder and checking deltoid contraction. And that will conclude this episode of our USMLE Step 2 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. As always, you can learn more and read other Step 2 questions at medprep2go.com. Happy studying! Hey everyone, Chris here from MedPrep2Go, and I wanted to tell you about our MedPrep2Go Step 3 Review podcast that features over 90 episodes and 40 hours of high-yield content from Dr. Ted O'Connell and Dr. Raj Dasgupta. This is a premium podcast that has already helped over 100 students pass their exam. You can learn more and subscribe at medprep2go.com.
Class is now in session, and the UPS Store is here to help you ace arriving on campus. Our certified packing experts can pack everything you need, from desktops to decor. Plus, when you pack and ship with us, you get our exclusive pack and ship guarantee. Your items arrive safe or your money back. Restrictions and limitations apply. To get a 20% off packing coupon and for full details, visit theupsstore.com/packing.